Hello, everybody. This is Dr. Cindy Banyai, candidate for Congress here in Southwest Florida, Congressional District 19. Thank you so much for joining us here for our first virtual town hall meeting. This session is going to be recorded and shared because it has a lot of great information to help keep you and your family safe during this public health emergency. I see a handful of people online. We have myself, I am here. We have Dr. Janelle Christensen. She's going to tell you a little bit about herself in just a moment. I have part of my team, campaign coordinator Eddie Thinger here joining us as well. I see a few friends online. I see Lauren, hello, and Patricia and Hannah and JR. Thank you so much for joining us here today. I know that this is an unprecedented time for us here in the United States, and it's something where we really have to continue to come together to connect with one another, to learn and do what's best to get through this crisis. And so this is one of the reasons why we wanted to have this information session with you and this town hall to hear from you about what's important and what you need to know to make the best decisions for yourself and your family. We are going to be monitoring the question box. So if you have anything to say or add in questions or comments, please put it into the question box. And Eddie is going to be there to help make sure we get that information. You're welcome to put it there, or you can address it to our special guest, Dr. Janelle Christensen, who has just a wealth of knowledge on disease and disaster to share with us to make sure that we are exceedingly prepared and informed about what's going on in the world around us. I will also say that as somebody, much like many of you who has been thrust into the virtual lifestyle here, I have many things going on at my house. I do happen to have a fantastic background, but you will probably at some point in time see one of my children pop in. My cat may run across the screen, and I'm also having my air conditioning replaced. So these are things that we need to deal with to make sure ourselves and our lives are going. And I'm just a regular mom like a lot of other people. So I'm going to be doing my best to keep engaged and listening to what's going on here. But there may be some times that I'm going to have to help my crew here. So just, I hope that you understand that, and that, you know, this is part of our new digital life. So, but thank you so much. We're going to who are going to be posting questions via Twitter and Facebook. So we're going to be monitoring both of those platforms as well to engage with this. But without further ado, I do want to hand it over to Dr. Janelle Christensen. She's going to tell us about her experience. She is part of Florida Southwestern State College, right? Edison came right back to my mind, but FSU.
Everyone knows what you're talking about. Yeah, Edison / Florida Southwestern State College.
So she plays an important role there around data and measurement and a lot of other things, but she has a background that's really, really pertinent to what's going on in our current state right now. So I'm going to let her take it over from there, and I'm going to be here to help facilitate the discussion and to learn along with you. And she shared some information with me that she wanted to share with you, some additional resources. So I'm going to be working to get that prepared, and we'll put that in the handout box for you. So thank you. Go ahead, Janelle, take it away. Or Dr. Christensen, please.
That's fine. No, Janelle's fine. I am not a medical doctor, not a physician. I have a doctorate in medical anthropology looking at comparative healthcare systems. And my research was specifically on disaster preparedness for older populations in Florida. Most of that research was in nursing homes and people providing care for loved ones in the community during complex emergencies. And though that was kind of focused on hurricanes and climate change related disasters, this is also part of it. Yes? Okay. Do you have a question for me?
We see you guys here, so I'm just...
Okay, yeah, no problem.
Thank you, sorry.
Sure. I didn't know if you had a question. But in addition to that, I put myself through my undergraduate work working in an emergency room. I was an emergency medical technician, an EMT. So I'm very sensitive to how emergencies like this can affect our medical care system. And that's really where we're going to see most of the stress and where our concerns are as public health professionals. And that's why you're hearing a lot of the language about flattening the curve. We're talking about the capacity for our medical system to respond effectively to people who have the illness and keep them alive, and so that we're more likely to survive, especially more vulnerable populations. So I'm just going to go over a couple of facts, because there's been so much misinformation out there from the presidency on down, and they're just now starting to get corrected. So I'm going to do the best I can to reiterate the facts that are backed by science, and I will go over some things where it's unclear and try to clarify to the best of our knowledge where we're at with that. So I think many of you have heard that though COVID-19 is like the flu and has many symptoms that overlap with the flu, it is not the flu. It is highly infectious and it can affect the lungs in a more aggressive way. So that's why you're hearing about the dry cough. And the fever is a very common symptom. And it's also a lot deadlier from what we know. The data is still not very good, but it's looking like it is very deadly, more deadly than the flu. Of course, I will admit, we are not really great at tracking deaths from the regular flu. So there are some unknowns, but the fact of the matter is this is not the flu. It's caused by a different kind of virus, and it is more deadly. From all the data that we have, those are the facts. Now, here's the other tough part. Like, I woke up on Tuesday with a tight chest, and I took my temperature, and it was not very high. It was 99.2. I took it again an hour later, and it was normal. I was feeling crummy. I have a headache, a little bit of a sore throat. What am I going to do, right? There's not tests available. So I have no idea if I, in fact, have COVID-19 or not. And even if I'm staying home. I'm not at work. I decided not to go to work. I have the capacity to do that for my job. I'm very lucky. Not everyone has that. But I at least am able to reduce the contact rate I have with other people. Like Cindy, however, I have 2 small children. And they are little vectors, and they may not even show that they're sick, and they may be passing it to their grandparents. So I'm really concerned about that, and we all have to think about that. And a colleague of mine up in the state of New York said that their guidance is, if you have any of the symptoms of COVID-19, assume you have it and treat it accordingly, which is intense, because that means I have to start self-quarantining now. Convincing my family that it's that serious is a whole other thing too, because we're working with other people in our lives. This is not an autonomous choice. We're trying to convince other people to take it seriously as well. So we're dealing with a very real human condition here. So that's something I just want to say. This is very real, and if you are concerned about a loved one who's not necessarily taking it seriously, that is normal, and I share your pain. So here's the other fact that I want to share, though. Because we have a lack of tests, and it's really hard to track what the real case rate is, or even the real death rate, we don't really know as much as we should. And again, this is human error. We could have had enough tests. We could have contained this early on, had some different choices been made by the higher ups. Right now, it does look like we are on the same trajectory as Italy, though roughly 10 days behind. So if you look at what's happening there, that's probably what we're going to be looking at in about 2 weeks. So I have some links there to some articles that are talking about that, as well as the test shortages and that's beginning to be rectified. But I, who have woken up with some symptoms and I'm feeling like crap, called my doctor's office, because that's what you're supposed to do. You call your physician's office, you report that, and then they will ask you, they'll do a triage. They're going to evaluate your symptoms, and they'll see if you qualify for the test. I don't qualify for the test because I don't have a fever and I'm not in a high risk group. And that's okay, because I think I'm going to be all right. And I want the people who are in the most need to get those tests. The challenge is, though, again, how do I deal with my family? So what we're doing right now is a best practice. We are suspending in-person meetings. We're sharing evidence-based information. One can have the virus and not know it and be able to and spread it to others, and that's another complication to all of this. So again, state of New York says, assume you have it, treat it accordingly if you can. Right. So all of this document here it's kind of what I'm using. It has links. All of the blue parts are links to articles that are backing up what I say. One of the biggest
and so
dangers.
Let me just make a note something about that as well, folks, is that I just tried to upload it to the handouts. For some reason, GoToWebinar is having an issue with that. So I am going to email this to everybody afterwards so you can see it and have this information and follow these links along. And thank you, Dr. Christensen, for putting this together for us.
Sure, absolutely. I just want to say, like, this is, the Washington Post also has a really great graphics and models that show how social distancing can work and how we can prevent overwhelming the medical system. And so that's why you're hearing all of these things about flattening the curve. Again, this is one of my main concerns as a public health professional and somebody who's worked in the medical field in the past. I'm not currently licensed in that way, but you can see how if everybody gets sick at once and goes to the hospital at once, then there's only so many medical personnel, there's only so many machines, there's only so many x-ray machines, there's only so it gets really overwhelming very fast. And and that's why we have the triage system to try to evaluate who needs these resources the most. Right now, it's a good thing, we're giving the most resources to those most in need. But say a hurricane comes and hits us, then it flip-flops. And then they're going to say the people most likely to survive get the resources. And so right, they call it reverse triage. And that is, I write about this in my book because it's very problematic. There's some, the reverse triage comes out of the military. The military is like, they want to treat the people who can get back out on the field as quickly as possible, right? So when there's a mass casualty incident, like a bus crash, then they're going to implement something called reverse triage. And that's what's going to happen if, number one, we start getting a overwhelming amount of people who are sick at the same time and our system doesn't have the resources to fit it, or if a natural disaster happens on top of this. So right now, I know that's scary to think about, and we're not there. And we're not even in hurricane season yet. So it's going to be fine. I just want people to know that this is how the medical system operates. Normally, the triage system works to give resources to the people most in need until it becomes completely overwhelmed. So our job is to make sure the system does not become overwhelmed. That's why we're trying to stay home and flatten the curve. Because once we reach the point where there's, we've run out of respirators, then they're going to have to decide that, your younger people who supposedly have a greater chance of survival are going to be getting those scarce resources. And we don't want to get there. We want to make sure that everybody who can survive this, if given given proper treatment, has that chance, right? I don't want my in-laws to be denied life-saving medical care because we just don't have enough. And again, this comes back to human planning. These were all choices that were made by administrators.
Yep.
So
absolutely.
This is
well,
not.
I just want to say, before you go on, make sure if you guys do have a question, put it into the box. I saw somebody was saying that they had trouble seeing. That might be an issue with rearranging either your video or the screen on there. So if you toggle around, hopefully you'll be able to see us. And if you're unable to see us, you'll be able to see us in the recording. But please do put those questions in there. Janelle, Dr. Christensen is a wealth of knowledge on this, obviously. And I also just wanted to add in that, we are in the same situation as your family right now, Janelle. My kids who are 3, 7, and 10 have been kind of on alternating days, taking like one's got a cough one day, one's got a cough the other day. And they were doing the same thing that you were saying. It's a 99.1 temperature, and then you take it again and it's back down, and then it's back up to 93, 99.4, and then it's back down.
Right.
And so we were in the same circumstance where we were, okay, now we probably not sick enough to go to the doctor yet, but definitely I said, well, we can't go out, because I wanted to be responsible and making sure that we were acting in a way that was responsive to our community and making sure that we were not spreading the disease if we are in fact carrying it. I did, by the way, though, put in a special call to the Golisano Hematology Oncology, because my youngest daughter, had a rare blood disease that was from an autoimmune disorder, and then she was immune suppressed because of the chemotherapy that she had as a result of that. And she is now okay, but it turns out, and I had called to confirm this, that her numbers were like just okay, like just over that line where she was good. They're like, we probably don't need any more treatment. You're good enough for now. And I said, hey, are there any special considerations that we need to make? Is there anything that we need to do? Should we come in? Do you want to give her another treatment? Like, what do we need to do there? And, they advised me that, okay, she's going to be okay for now. So here she comes. There she is.
Yeah.
Hi. She's going to be okay for now. And I love you too. And that just to keep monitoring it, but otherwise we are here, in our self-isolation. So
yes. That's what you need to do. And it's really hard, especially if you're running a campaign. You want to be knocking on doors and getting to know people. And how do you do that? So we're doing it now. This is the kind of thing we need to be doing. And again, the problem is overwhelming the medical system. The reason why they're rationing tests is because they have a protocol in place, like who's going to need it the most. And your daughter might qualify, and just to rule it out so that you're not scared. But that's just it. There's so much unknown. And that is another way. This is sort of like before a hurricane hits, is sort of what's coming, but you don't know exactly where it's going to hit. You don't know if it's going to get stronger or peter out. So the uncertainty is part of the stress-inducing aspect, right?
Absolutely.
So here's a couple. I wanted to move into just talking about some rumors that there was a lot of confusion about. For a while, people were saying this is zoonotic, and you can and dogs can get COVID-19 and maybe even give it to other people. And then for a while, they were saying, no, that's not true. They ruled it out. But they just came back and said, actually, we've confirmed a case where a dog has COVID-19 in Hong Kong. So the WHO is now saying, yes, this is zoonotic, and dogs can in fact get this. So it's something to keep in mind. It's exhausting trying to keep on top of all of the new facts, but that's something I just wanted to clarify, because I was looking at that. So, and I do have an article there, and you can see it. Again, it's only one dog though, so we don't know how serious it is, or if how it's all working. So there's still a lot of unknowns. The other,
before you move on, can I just say something about that as well?
Sure.
Just to help people understand too, as I told you, my littlest, who you saw just wandering up here, Evie, she's been through a lot over the past couple of years. And I remember feeling very frustrated with the medical system, like, oh, they're not giving me the answers I want. I want to know what's wrong, and I want to know what's wrong right now, and how are we going to do it, and what needs to be done. Right. And I just want to share that one of the things that I learned through that experience is that it's not clear cut. When the medical professionals are in there, they're trying to do different diagnostics. They're assessing what's wrong, and then they're applying the diagnostic to either say yes or to rule it out. And that can feel like a very uncertain process for people. And I think some people get very frustrated with it. Like, why don't they know everything? They should know everything, and they should know the answer.
Right. But
I want to share with everybody, have patience in this, but also have faith that the people who are doing the research, the medical professionals, they're not trying to like pull one over on you.
No.
They're not trying to mislead you by saying, oh, this or maybe that. It's just the nature of the science. It's just
the nature of science. They're in the process of ruling it out. Even doctors are kind of working as scientists, ruling out things as they go. And it's hard, and finding like what treatments might be most effective, what does the least amount of harm. And of course, it's also coming down to the what's best for the population as a whole. So that's why I don't qualify for a test, though it would ease my mind. They are making sure that people who are older and having fevers and meet more criteria are getting them. And that's how it's supposed to go, as frustrating as it is. Again, I still maintain we should have had more tests a long time ago, but dealing with what we have now, the medical professionals are doing the best they can. That's a great point, Cindy. So what, again, and new information is always coming forward. Like,
Absolutely.
yeah, dogs can get COVID-19. It's not a widespread thing. There's only one case, but it's something that y'all can keep in mind. Now we have it confirmed, right? And we may learn more. We may learn that they can't give it to humans. We don't know everything yet. So the other thing that we don't have great data on, there was a rumor going around, and it was just a rumor because it was just based on a few observations, saying that ibuprofen can cause the disease to become worse, which was counterintuitive to me because ibuprofen is an anti-inflammatory. And one of the things this does is causes a lot of inflammation in the lungs. That's why you can't get a lot of air in. So I was thinking, how can that be true? Well, we don't know for sure because there's not a big epidemiological study to back it up. However, there's been enough cases now where the WHO is recommending that you use Tylenol instead of ibuprofen. So this is one of these things that later on we may find it's not true. But if you have the option to use Tylenol, paracetamol is the off-brand name, then instead of Advil or ibuprofen, then it's safest to do that. We're going to just err on the side of caution. Again, there's a lot we don't know. We haven't looked at a large population yet, but they are making an abundance of caution, as we all like to say, in an abundance of caution, Tylenol before ibuprofen. So again, I just wanted to cut through some of these rumors and where we're at in science. Now, if you're like me and are feeling crummy, Gatorade, you sweat a lot if you do have a fever, so you can become dehydrated and that makes you feel way worse. So Gatorade or another electrolyte drink. I've been using Emergency. I like them because they don't take up as much room in my cupboard. And I just add this to a cup of water. I recommend people add this to their hurricane kit because if your power goes out and you're like Cindy and don't have a functioning air conditioning unit, you're sweating, then you want to make sure that you're replacing your electrolytes because that can it can make everything worse. It can actually cause delirium if you become dehydrated, and that's like having signs of dementia, but you can make it better as soon as you're rehydrated. But this is just something to keep in mind, especially our older populations are more at risk. Our bodies aren't as good at regulating temperature as we age. So making sure that you have some, and this is easier to carry, it's not as heavy as big old Gatorade things, but that's something that I like to do. And it also has some vitamins in it, but it has electrolytes. So that's the real reason why I recommend it. The other thing that you can do is I have some zinc lozenges. Zinc lozenges are supposed to help reduce, it's harder for the virus to get a foothold, basically. So that's kind of a prevention measure. They are recommending tea and with honey in it. If you have honey, then that can be helpful for the throat, and it is antibacterial. And then cough syrup. So, these are all things that you can do if you're like me and are feeling a little crummy. Tylenol, keep yourself hydrated, get your rest as hard as it is. I think it's hard when you're stressed out and have kids wandering around. And just do what you can to stay isolated, reduce contact with others, and that's what they're recommending. Treat it like it is potentially COVID-19 if you have the symptoms, and the treatment's the same unless you have shortness of breath. If you start having shortness of breath, call 911.
Yeah, that was something that I was going to ask too. So at what point, like you said, your temperature was, low grade, kind of coming in and out. So it's not serious for you, but what else should we be looking for aside from that shortness of breath that we may either want to take ourselves to the ER or have to call 911?
Right. So I'm not a physician, again, I just want to qualify that, but the basically, if you take a deep breath in and you're feeling super tight and can't quite get enough oxygen, then you definitely want to call your doctor. And if you're coughing and having trouble getting air in, you need to call 911 immediately, because they can get albuterol, they can help, they have medications that they could even treat you on the way to the hospital and make sure that your lungs are getting opened up and that you're getting oxygen to the organs, because that's ultimately what will kill people, is that if they can't get enough oxygen to their organs, then this body starts to shut down. So oxygen, we need it. We need water, we need air. Make sure that you can get those things into your body. And if you are having any trouble at all, get professional help.
Yeah, absolutely. Well, thanks for that. And I know that there's, like my children's pediatrician has opened up telehealth as well. And I know that there's been some work with various insurance companies to make sure that continues to be an option for people. So I do encourage everybody to take a look at that. If you are doing self-isolation or just doing, really stringent social distancing, you can take a look to see what your provider or provider near you has in terms of telehealth. If you're on that line, you're not sure, but they'll be able to tell you, yes, please come in, or no, stay home and home treat. And I think that's a valuable option for people to have.
I also want to say that the researcher in me wants to encourage people to call their physicians if they have any symptoms at all, because epidemiologists are going to be going back and looking at charts after this, and they're going to want to see, how many symptoms were reported. And there's a lot of, one of the major problems we always have is that, of course, there are plenty of people out there that weren't reporting their illnesses. So it's not, if you have symptoms, it's not going to hurt to call your doctor and have it documented. It'll only help.
Yeah. Thank you. And that does add to the knowledge that we have later on.
That's right.
Which I know people who are nerds like you and I think about that. But I do want to say, to encourage everybody who is here. Eddie, do we have any questions come in?
Sorry, my mute was on. I'm not seeing any.
Okay.
Other than the screen not working.
Okay. Got that sorted out. So technical feedback is always helpful. Thank you. But yeah, so if anybody has questions, let us know. I do have a question. I just want to talk a little bit about this. Thank you for the valuable information about what we need to protect our health, and a little bit of a warning on kind of what we need to understand to take it to the next level in terms of, or what may happen if we don't take it serious right now and we get into hurricane season. But let's talk a little bit about what could have been done better in your opinion.
Oh boy, I've been screaming about this in text messages to my friends. I'm like, what is happening? So thank you for asking that, because I have some feelings. The moment that they identified a potentially highly infectious disease in any other country, there should have been, all administration should have been on alert. There was a warning. There were tests developed early on by people who have been working in Chinese citizens who have been working in the United States, and they felt pressured by our administration. There were all of these investigations, so they went back to China, but they ended up being the people who developed the tests to identify it. So number one, believe scientists. They could have believed scientists early on. They could have kept going back several years. I'm going to go backwards. So this has been kind of a slow rolling disaster where the CDC, the pandemic team was put in place after the Ebola crisis, and that was a slow rolling disaster. Because of the way it was passed one human to another, it was less infectious than what we're dealing with now. Yet they started putting tools in place to protect people should something like that happen again. And you need people, and you need the finances behind that, so that should an emergency happen, there's tools. Well, this administration tried to cut funding, and I think they weren't successful in cutting it as much as they advocated for, because Congress stopped them. But the other thing that happened was the pandemic team, I think they resigned, and those positions were never replaced. So it just wasn't prioritized. You have to prioritize these things. It's sort of like FEMA getting, right before Hurricane Katrina happened, FEMA had been, funding had been cut. They put somebody who wasn't really skilled in charge. We're seeing the same pattern happening. You've got to have skilled people in positions where they can, and when people tell you there's going to be a problem, you listen to people who are experts in the area. And that didn't happen. So if we had experts in the area, we would have had, and the WHO offered tests, and they were refused. So the shortage on tests is completely human-made disaster. Basically, the reason why I'm not able to be tested and rule things out right now is because we said, no, we don't want those tests from the WHO. We're going to develop our own. And then there were a bunch of false negatives. So these were completely avoidable mistakes. Second, we had the president of the United States saying it was a hoax, telling vast parts of the population that this is not something you have to take seriously. And that delayed appropriate action for weeks. So even if there were tests, there were probably people who should have taken them that wouldn't have. And that's just a huge public health messaging nightmare. So one of the things that public health professionals say is, like, first, you have to, for people to take action, they have to believe the risk is real, know what to do, have the knowledge on what to do with that knowledge, what to do about it, and then have the resources to be able to do those things. You're not going to get a disaster kit if you don't have money for it. And, what we had was a breakdown at the very basic level. People weren't going to believe it's real if they, so that's it. Like, we could have had the tests, we could have had effective communication, we could have had effective communication about what to do, we could have had the financial resources to do it. We're working on it right now, but again, this all could have been done. We knew about this in December, and we could have been taking response. And then, the best thing in public health is people will be like, oh, what an overreaction. Nobody got sick. We did all of that work for nothing. And we're like, well, that's what you hope happens. Like, if public health works, you think it's an overreaction. Yep. And unfortunately, we're looking at this and we're like, you missed so many opportunities to do the right thing. Anyway,
it's kind of like hurricane evacuations too, right?
Correct. That's exactly
Everybody leaves, and then they come back, oh, it's not that bad. I'm like, I came back after Hurricane Irma. I was looking at my house, and my house was still standing, thankfully, but like everything else was like, everything around it was like torn down. My fence was ripped off the post. And I'm like, I don't want to be in the house at that point in time.
If it had hit just a little differently, I know that river, the Caloosahatchee, would have flooded my entire neighborhood. And I didn't want to take it. It just, so much can change so quick. It's really about risk evaluation, and was it worth it? I think it was worth it to get the heck out, because I did not want to be trying to chop through my roof with an infant in my arms, and so making that choice, like, what do you want to be? What kind of situation? So you have the systematic federal, the state, the local government, all the healthcare systems, all in place, but and then you have personal choices, right? And we all have to make personal choices with the best information we've got to how to protect ourselves. But again, we have to believe that it's a true risk. We have to have the right information on what to reduce that risk and make, what can we do to keep ourselves safe. And third, we have to have the resources to be able to do that.
Mhm.
So,
And we're kind of lacking on all those points at this point. I mean, it seems like we finally, and really just in what, less than a week, have had our federal government take this as serious as it needed to be.
it was like
And
within a few days, it was complete different messaging, and that confuses people.
oh yeah, and there are still people who don't believe it, and they're unsure because it does. I mean, it's like the calm before a hurricane. You walk outside, the sun is shining,
It's
the
beautiful
sky is
out. How could there be a storm? Those liars. Yes.
yeah, right. And it's easy to, not to make a different decision because it's completely against like what all of your senses are telling you to do, like that everything should just be fine. You have to take that next step on it. And that's what precludes people from making those decisions.
Right.
It's why it's absolutely necessary to have trust in our public institutions.
Absolutely. And it's been decimated. It's so sad.
Absolutely. And when we have leadership that is not instilling trust into our public institutions, this is what happens. And this is why the Bannon Doctrine in the White House coming through saying, oh, let's put the person to destroy the agency as the head of the agency for, I don't know what, fiscal conservatism or something, is the most asinine thing that we could have possibly thought in terms of our government. Right. We actually needed the opposite. We needed people to reinvigorate those organizations, to look at how to make them more trustworthy. Fine, let's talk about streamlining them. Let's talk about making them more efficient and effective. Hey, I'm right there. That's my game, making things more efficient and effective. Okay, this is what I do for a living. Okay, so, but let's be smart. Let's not undercut the work of these agencies by putting people in there to destroy them. Let's not leave critical vacancies open to, save a buck, because we don't have enough forethought to think of, well, what happens when a disaster does strike? And this has reached that critical mass. It's so quickly, we cannot recover in terms of the institutional components, right? You can't hire these people like that, right? Experts in these fields, they're not sitting around waiting for a job. If you didn't hire them then, they're gone.
They're working for France.
They're working somewhere else. So, I mean, the idea that you're just going to call up all these people when you need them, it doesn't work like that. Our government is not the Red Cross. Okay, right. That's what the Red Cross does because they understand disaster management. That's what they're there for. They're there when it's an emergency and you call them up and they go and they solve the problem and that's it, right? Mm-hmm. But our government is there to provide critical services along the way, right? And to help prepare us for when there is an emergency and a disaster and mitigate the effects on life, property, and economy. And now we're seeing, because of the specific mismanagement on behalf of the federal administration, on down, but led by the federal administration, that we are seeing major crises of health, life, business, economy overall, and it could have all been prevented.
Correct. That's the worst part. It didn't have to be this way.
We didn't have to be this way. My friends who are small business owners, they wouldn't be standing in line for food stamps today because their business is going to be closing down, if not today and in a week or so, because guess what? They can't handle 2 weeks without customers, let alone 30 days, 60 days, 18 months, forget it. All these people are going out of business. And then what do?
Yeah.
So I'm angry.
I am too. So I think this really shows the intersection of both health and economy. And I would argue even the environment. All of these things are deeply interconnected and a person has to see the big picture. I know it's a lot, but if leaders need to see the big picture, they can't just think about the economy. When they ignore these other critical functions, then the economy is going to tank eventually. And this is some of the worst we've ever seen. Like we've never seen this in our generation. My parents' generation has never seen this. Maybe our great grandparents did, great influence.
I don't think they had the organization. I mean, that was the point. Like, we're supposed to learn from those past devastations. And that's what people don't realize. And I tell my
trust
students,
scientists. Yeah.
Trust scientists. Yes, exactly. But we didn't come up with these administrative things out of nowhere.
Correct.
a lot of them came out of disaster. They came out of loss of life. They came out of tragedy. And then we said, hey, let's have things like building codes and, trash removal. It wasn't because these were just things that sounded like a good idea. Let's build a bureaucracy. It's like, no, people die when you don't have building codes, when the buildings collapse. And if we don't have public, waste management, then there's disease and it's disgusting. And you can't live like that. So all of these little things, they don't come out of nowhere. And we may be sitting here 100 years away from when these parts of the administration were built in our public governance structures, but that doesn't mean that they all just need to be trashed because we no longer understand how they came about, because we're going to learn real fast. We're learning real fast right now.
But here's the other thing is, with hurricanes, I use this example, the more people who survived hurricanes, our houses are built to code, right? Because we learn from past experiences. Hurricane Andrew changed the way Florida built. But then here we are just 20 years later, and there are people in government trying to undo all of those, one regulation at a time and build in unsafe places because they want to make they're making short-term decisions, right? So we see that. And also people who lived through a hurricane and didn't have a problem with it, they're less likely to evacuate in the future. They're not going to trust the scientists because they think that it's unnecessary because they were fine before. But the thing is, with these sorts of things, with something like a hurricane or a pandemic, they're all different and they all have different factors. So one has to trust experts to say how, it is different and take different paths. Evaluate it on what you have in front of you, not just experience. Sorry. So it takes a little bit of both on our individual level as well.
Hey,
but thank you.
I was gonna say, I saw some questions in there. What do we have?
So someone was asking how Representative Mario Diaz-Balart was able to get the test because, as Janelle was saying, we're being told we shouldn't get the test unless we're having symptoms, and he wasn't having symptoms, so much as he was saying. So, Janelle, you're having symptoms, but you can't get the test.
No.
But he wasn't having symptoms, but he was able to get the test.
I have no idea why that is the case, unless he was somewhere in another country. Yeah, I don't know.
He absolutely must have been having symptoms, or he got exposed to somebody.
I don't know. Yeah, exactly. So
Did he get exposed at Mar-a-Lago? Maybe, I don't know.
Maybe that's the other thing. One of the criteria is, have you been in contact with somebody who tested positive? And he must have. That may be what the criteria was. To my knowledge, see, here's the thing though, is there aren't a lot of tests. How do I know? Like if you're not tested positive, then because there aren't tests, like we have no idea who's exposed. And that's why they are saying we have to just assume, like I have to just assume that I have it. Even though I don't have all the symptoms and I don't meet the criteria, I have to act like that now, which means I don't get to go to restaurants. I don't get to, we're not able to just quarantine people who have it. We're quarantining everybody, and that's what's causing this economic collapse.
And you know what? I will say, this has been, okay, so I lived through SARS. I was in Taiwan during SARS. So this was not even my first rodeo to pandemic and countrywide shutdown. And it was very bizarre, I will say, in SARS, how just watching a city of 12 million people in Taipei go from being bustling metropolis to nothing, and I thought it was eerie, but I will tell you, and from all accounts, Taiwan has been one of the examples globally recently of like, how do you attack, how do you address this and how do you do it swiftly? Keep in mind the geopolitical situation with Taiwan is that they are barred from information from the WHO. Beijing will not allow any experts, any information, any knowledge from the WHO to go to Taipei because they consider Taipei their renegade province. And they say, oh, all the information is going to come from Beijing to Taipei. So we got it, no worries. But of course, they don't give them any information. So Taiwan has kind of taken from the very beginning this very, like, oh my gosh, we're on our own. We have to figure it out. We need to take extra precaution because they know that they were left out of the knowledge loop on it. So even during SARS, before they shut down, and they ended up shutting down the city for 2 weeks, before they did that, we were testing, we did have tests, they developed a test for it, but they also, everybody was taking their temperature. So I was working at a kindergarten. Every kid walking in the door that day got one. If they were 99 or over, they were back home, So taking the precautions beforehand. They also learn, I will say, by the way, a lot about that disinfectant, how to do that on like a large scale. How do we disinfect an entire school nightly, right? So that people aren't getting sick. How do we disinfect the public transportation nightly, so it's not happening. And I will say that we were only shut down for 2 weeks in Taiwan for SARS, and we were back up and running.
And that's, if you do it right, that's how it should be.
Yeah, and that's part of the mitigation, right? Not the suppression. We're in the suppression part where it's like, it's everywhere. We have no idea how or where, so we just have to shut everything down. They were able to get a hold of it there, but it was because they took it serious from the outset, because they knew they were on their own.
I would say that for this round, the best examples are Germany and South Korea. You can trust their numbers and data. You can't really trust ours. Or, yeah, anyway, go on.
The other thing I was going to say that's been very bizarre for me for this, even having been through a similar experience, right? Even though, like you said, they're different, but it's,
yeah,
at least
there's certain patterns that we learn from, yes.
Self-isolation thing before. But the thing that's weird, the celebrities, basketball players. Now, what are we looking at? 8 NBA players have been diagnosed. Heads of state, being tested. We have,
social inequality.
And, representatives, Diaz-Balart getting it. There was actually a CEO of Santander Bank in Portugal that died from this. I mean, and I don't know if that is just like a testament to the community spread of this.
It's way more widespread than we know is the problem.
That's what I think it means.
And
I mean, what is your take on that?
Absolutely. Like, it is way more widespread. We just don't have the tests to capture it. And that's why our data is bad. And that's why I'm saying you can look at Germany and you can look at South Korea, and that's probably the most legitimate because they caught it early. Italy is, behind the curveball because they denied that it was a problem so long, and it just got out of control. So yes, it is way more widespread. We will have better data after the fact, but we just aren't going to know. Now, now keep in mind, some of these celebrities travel a lot, and so who knows where they were exposed, but they certainly brought it back with them. I would say that Tom Hanks was able to be tested right away because he was in Australia and they had more tests there, and they took the WHO. So there's some that are being tested abroad, which is why we know, and we know their names. But yeah, ultimately, it's way more widespread than we know. And that's why if you show symptoms, it's best to just assume you have it.
Is there another question there?
Yeah, it's more of a comment than a question. But there's someone basically saying we need to be careful about getting drugs out right away because they need to be tested over time. Any sort of vaccine or cure. And I actually have a question, Janelle, about that. Because it's because of the type of virus it is, can there technically be a cure for it, or can there only be vaccines?
I think with most viruses, there's a vaccine, the prevention side. And then they have come up with Tamiflu for influenza so that can reduce and help your body recover. I don't know if you consider that a cure, but if you catch it early enough, it can reduce the symptoms and speed the recovery. So there may be some things like that. But yeah, there's viruses are a very different thing from bacteria. Bacteria, antibiotics kill the bacteria. Viruses are very different.
So that's a good point to make, is that the other reason that this is such a challenge is that there isn't a treatment for it. And we're still in the development of the vaccine. And tell us the technical side on that, a very simplified version of the technical side of it, because I'm not sure if everybody understands how involved the process is of getting an FDA approved vaccine and treatment.
I mean, it took us years to start doing the influenza vaccine. And even then, they try to anticipate what it is beforehand, what strains are going to be most likely. And then they isolate those and they then create a vaccine. It has to be tested on animals before it can be safe for humans. Now, I believe that there are other countries, there are other, or, so it's not just us working in a vacuum. If there's a vaccine that's developed, it'll be based on the DNA of this particular virus. If it mutates, that can change things a bit too, but it has to be tested. And I mean, the person who made that comment, it's true. We can't just create it and put it out there. It has to go through several ethical, it has to be vetted and tested in a number of ways. And some people may not respond well to it for one reason or another, or there might be contraindications. There's so much we don't know yet, because we still don't have all the information about this virus either. So,
there's so much we don't know. And then when you're developing a treatment like that, it takes a long time. Again, it's scientists and how the treatments work. And actually, I'll even say this little one who's now wants to watch a TV show, but her disease didn't have any evidence-based recommendations.
Oh, that's
which
hard.
is very scary. I mean, as somebody who works in this kind of field of understanding what that means, and really it means that there was some clinical trials around things that had worked for people with her conditions, but there wasn't anything that had been tested and thoroughly vetted to treat people in that, randomized trial situation. And so so it ends up being a very scary thing. And at least there was something that had been worked on other individuals with her condition in particular. They borrowed from sickle cell anemia, treatment for sickle cell anemia to treat her conditions.
Interesting.
And so, but again, I will say that I understand the way that people are feeling about this, because, when there isn't an answer, right? Like, you can look at your child or your family member and know that something is wrong with them, but there's no clear answer as to how to treat them. That's exceedingly scary and frustrating, because you're like, but do something, and there's something out there, right? But the science takes a long time, and we need to trust the science, because that's how, when it is that it's been through the random, control trials, and it's been proven to work, and we know what the potential negative side effects are, which is the whole other component of this that we don't talk about a lot. But once we have that clearly understood, we can again do that risk management component of it as to whether or not this is something we need to do. So if this is the negative consequence, but this is the positive, let's weigh those costs and benefits on it. But we just don't have that data right now. We haven't had enough time to do it.
Sorry, I'm just. That's exactly right. And fortunately, there are countries that have been working on this for several months longer than we have. So we'll probably be needing to borrow from them. Again, there were tests developed by the time it started being a problem here. We just chose not to use them. I think maybe people are going to use whatever results they can here, but it will have to go through our protocols. And hopefully, there are treatments, and a lot of people do get through this, fortunately, without serious effects.
Yeah. I just want to do, before we kind of part here, I just want to make one pitch based off of what you had said as well. And that's the value of global collaboration around these kinds of things, and why it's absolutely necessary for us to continue to have a role in global institutions. That includes the entire UN system, of which the WHO is a part of. Okay, so everybody that just poo-poos all that and says, oh, we don't need all that, we're going to do it on our own, thanks. Well, look where we are now.
Right. That's
we did that.
Excellent
we said, okay,
point.
no thanks, we don't need those tests. And look where we are. We have a testing shortage, and we have the WHO ready to come and help us with that. But, you know, let's not forget that, yeah, we're not alone in this. We are here in it together, and we can rely on one another. And that's why we invest in these institutions. That's why we were the main parties investing in developing these global institutions.
So
They were
heartbreaking.
made because we need global collaboration to address the biggest problems. And this is one of them. And we've been in an eroded state where we've had leadership at the top of this country who didn't think that that was important. Okay, and this is what makes me sick about it. We need global leadership. We need to be part of that global leadership in terms of democracy, but also in terms of global collaboration around the biggest issues of our day, including this pandemic. And so I just really think that that's a very important thing to point out here, because we are in this state where we are because of multiple failures of this leadership, on multiple fronts, and it needs to be called out. And I just did. So you're welcome.
There you go. So you're welcome. Okay,
And,
thank you.
back down off my soapbox for a moment. Eddie, is there anything else over there? Any other questions from our audience?
Couple quick comments. First off, someone wishes you well, Janelle. Hope you feel better soon. And then someone else made a comment about how they had worked for the company that made the live flu vaccine, Flumis. And it took many years to test, and then it's tricky to have control groups for the vaccine and everything else. So that it's probably similar for COVID.
Probably. Yeah. That's a good point. Thank you.
Yeah.
Those are good comments. We had a good audience.
Yeah, great. And you know what? So with that, on that note, and we're just about at the hour time, I want to say thank you so much to Dr. Janelle Christensen for being with us here today and sharing this valuable information with everybody. I so appreciate that. And thank you to Eddie being part of our support team here. Thank you so much for being here today with us and supporting, and as well as all of our guests who are here, who have participate in our live session, and then who will watch this afterwards. I really do hope that you find this information valuable, and I hope that through this conversation too, that you can see essentially what you would get with me, with the leader, somebody who's got a little bit of spice and a little bit of knowledge and willing to bring in experts when we need to hear from them, but who's not afraid to tell it like it is and to speak up for what's right for Americans. And if you'd like to learn more about my campaign, please go ahead and check out my website at vote@cindybanyai.com. That's VOTE at CINDY, B as in boy, AN as in Nancy, YAI.com. You can also follow me on social media, SWFL Mom 2020, and that's across all the platforms, Instagram, Facebook, and Twitter. You can find me there. Also hashtag SWFL Mom 2020. I'm also, my three main issues, our health, our water, and our community. Hashtag all of those. You'll find all the comments I have about that. So I'm going to go ahead and end it there. Thank you so much. Thank you for being there, Janelle. Thank you, Eddie. Thank you, everybody. And have a great day. Bye.
Thank you.